One of the challenges of population health research is to understand and reveal the underlying health inequities that exist. Many of the scholars address this challenge in their research.
Race is a social construction, but it's a very powerful social construction. It has real effects. The social construction privileges certain groups on the basis of skin color, and it disadvantages other groups on the basis of skin color.
I did a psychophysiology laboratory study where I examined the effects of media-based racism on physiological, behavioral, and emotional responses in Black and white adults. So I was really interested in sort of pushing our assessment of racism forward in health settings. Predominantly, this research is focused on individual experiences with racial discrimination, so being called a name or being followed in the store, or having a direct encounter with a police officer. So I was interested in thinking more broadly about potentially more pervasive and relatively abstract experiences that might emerge through cultural expression, so use of language and symbolism and images. So I focused specifically on the media. So seeing a white male dressed in blackface as Trayvon Martin for Halloween, for instance, is the type of cultural expression that I was interested in. Similarly, I was interested in use of language. So for instance, Pat Buchanan referring to the president as a drug dealer of welfare. So the use of racially coded language in media. What I was particularly interested in is whether those types of exposures through media actually trigger stress responses that could be problematic for health over time.
I've started doing a lot of work on perceptions of race, not only at the individual level, but at the neighborhood level. Issues around stigma are central to understanding group disparities, particularly racial disparities.
So what we're finding are some really interesting patterns where Blacks and whites seem to be reacting in very different ways to different types of content.
So in order to understand neighborhood inequality, we have to understand the decisions, not just of African Americans or other racial and ethnic minority groups. We have to understand the decisions of whites. Most of neighborhood inequality right now is explained by the decisions of whites to leave central city neighborhoods.
So whites seem to have a stronger cardiovascular reactivity response to very blatant content. So someone in blackface, someone using the N-word, for instance. Whereas Blacks have a stronger cardiovascular response to very subtle references to racism content in the media. Interestingly, Blacks and whites didn't differ in what they told us they were feeling after they'd seen this content. So their emotional responses didn't differ, but their physiological responses did.
Initially, when I was looking at what happens in a neighborhood that affects how kids perform in school or how kids perform on a standardized test, for instance, I was looking for mechanisms, and more I started to think about what exactly goes on in a very disadvantaged community. I started focusing on things like quality of the schools, but also other aspects of social life within a community, like the level of violence, for instance, and started to gather more and more evidence on how community violence affects kids in the classroom and how this kind of reinforces and then reproduces patterns of inequality across different neighborhoods. If you look at kids, one of whom took a test right after a homicide occurred down the street, the other took the same test right before that homicide, then their scores will vary dramatically. So we can really pinpoint the impact of each incident of violence and how it affects kids in the school. I teach a course in urban sociology, and I focus quite a bit on neighborhood inequality, and particularly racial inequality, and I always begin the course by asking the students, well, should a red-headed white guy from the suburbs be teaching this course? And it's fascinating. You get a whole bunch of responses.
There's some personal responsibility there and it's also, to assume that I should be the teacher and tell you about racism is a very passive way to engage with these types of social issues. It also assumes that I own something about racism and that I have the authority over racism and I have to, share that with you, which is just not the case. If anyone has authority over racism, it's white people, I'd say. So.